Good morning, good morning, good morning. Merry not so stupid o'clock to everyone. Happy Thanksgiving. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels. And why am I made up? I'll tell you, as Tavia would say. Yes, my favorite musical of all time is Fiddler on the Roof. Fight me. It's because I have to people today. So, keep me in your thoughts, alright? I don't enjoy masking nearly as much as I'm going to have to do later today, but needs must. We're going to that horrible world known as the JRC this morning, but before we get started, folks, a few of the usual disclaimers. First off, you are going to see the link to this investigation done by the FDA right there in the description box, alongside the other pertinent links to the Stop the Shocks campaign. And excuse me while I adjust my camera. Including Autistic massive archive on the subject. Also the templates, folks, again. We are trying to end adversive therapy, seclusion, and improper restraints in the schools. It does claim lives every single year. And the ever-present and self-explanatory Change.org Shut the Judge Rotenberg Center Down petition. Folks, when we're talking about the JRC, you're going to hear vivid descriptions of and catch surveillance footage of peoples with disabilities being tortured and abused. If you have young children present, please use your headphones, okay? And it is 7:44 a.m. in the morning, folks. I've been up since 3:42 a.m. this morning, so if I stumble over any of my words, my apologies in advance as always. So back in 2012, before the FDA hearings got underway in 2013, the FDA did an investigation of the JRC. The result is the report we're going to go ahead and go through this morning. Now, this is going to be relatively short, although I have no idea why. But I guess it beats Judge Bernstein's book of nonsense now, doesn't it? So, let's go ahead and get started. I'm going to move a little closer so I can actually read this. It's kind of tiny type. Okay. This document lists observations made by the FDA representatives during the inspection of your facility. They're talking to the JRC here. They are inspectional observations and do not represent a final agency determination regarding your compliance. If you have an objection regarding an action with the FDA representatives during the inspection, or submit this information to the FDA at the address above. If you have any questions, please contact FDA at the phone number and address above. Please don't look at that. Moving forward. You didn't see a thing. Observation 1. Procedures for design validation have not been adequately established. This is in reference to the GED3A and the GED4. Remember the numerous times I told you that they did not get a license for those devices to use for treatment? Yeah, they're supposed to do that. So, again, tell me, DC Circuit Court judges, why do they not have authority again? Considering, it is their job to license devices that are used for medical treatment. Moving on. Excuse me. Allergies. Specifically, your quality manager stated that the designs of your graduated electronic decelerator devices models GED3A and GED4 have not been validated. Thank you! No design validation report was available in the design history file for these models. That it is not available to demonstrate the devices meet user needs and intended uses. Yeah, no, there should be no intended use anyway. Observation 2. The design history file does not demonstrate the device was developed following the requirements of 21 CFR 820. Specifically, the design history files for the GED 3A and 4 are incomplete. For example, the design inputs document provided for both models entitled blah 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 is in draft form and does not reference the GED4. Observation 3. Pre-market clearance or approval was not obtained prior to implementing significant changes to a medical device. Specifically, on May the 23rd, 2011, your firm was notified by the FDA that your graduated electronic decelerator devices models GED3A and 4 have not been approved or cleared by the FDA. Your firm continues to maintain the GED3A and the GED4 devices and use them for clients for aversive behavioral therapy. On October the 3rd, 2012, you provided a report from your GED tracking database showing clients were wearing a total of blank GED3A devices and blank clients were wearing a total of blank GED4 devices. The labels of your GED3A and GED4 devices continue to state that the device is intended for use of severe behavioral problems, and the GED4 complies to be operated at a significantly higher output than the cleared device. So there's the inspection of it. So what are they saying here? You have no clearance to use these devices as medical treatment on the students that are in your center. You also told us that those devices are only being used for the most severe cases. We've already proven they were not. We've also proven the fact that any type of adversive therapy is completely ineffective in treating any quote unquote behaviors. And why? Well, I'm going to bring up the obvious. Because you cannot use behavior modification to treat a neurological disorder. Now, why is that? I'll make it real simple for you. Because they're not willful behaviors. Okay? It is very simple. These behaviors come from our neurology. They have certain triggers. When those triggers are hit, we're going to display certain behaviors. It is not voluntary on our part. It is not something. Okay, when you have a behavior that is involuntary, that comes from your neurology, there is no there's basically, but Tiff, can't you use alternatives? No, that's the point. That's the point. Okay? It is an unwilling behavior. So how in the name of God are we going to counteract that with what a behavior you all deem appropriate when the behavior in the first place is not a willful behavior? If it were a willful behavior, sure, maybe then behavior modification might be used. But these are not willful behaviors. They come from our neurology. So no amount of behavior modification, be it through horrific means like the GED or any form of softer freaking ABA, is going to stop that behavior from occurring because it's not willful. It is involuntary, okay? God, the fact I have to say this in 2021, it makes me worry about humanity and their use of critical thought. It really does. Now we're going to take a look at a few other things here, and don't worry, there will be links to all of this. Oh, for the love of God, that's not even what we're doing. Okay, we're going to autistic Hoya, and I have to get up close so I can see. Okay. There are more on this. Okay, so we're moving forward here. Now we're going to have some warning letters that were sent in further on into that year. This is coming from June 2012, 29th, 2012. So let's read it, shall we? Dear Miss Crooks, on November the 9th, 2010, through November the 23rd, 2010, the U.S. Food and Drug Administration, FDA, inspected your manufacturing facility located at blah, 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 blah. As a result of this inspection, we sent you a letter to your firm dated May the 23rd, 2011, indicating your GED3A and GED4 devices are adulterated under Section 501 IB of the Act 21 USC, effect pursuant to Section 515 of the Act 21 USC, or an approved application for an investigational device exemption IDE under Section 520 of Act 21 USC. Our letter also describes serious problems with the current good manufacturing practice requirements of the quality system regulation found at Title 21 Code of the Federal Regulations, Part 820, and the Medical Device Reporting Regulation found at 21 CFR. On July 13, 2011, a regulatory meeting was held at our office to discuss these deficiencies. During this meeting, we discussed the need for your firm to come into compliance as soon as possible. We are in receipt of 11 responses that were in response to our May 23, 2011 letter. These dated July 21st, 2011, September the 14th, 2011, October the 14th, 2011, November the 15th, 2011, December the 15th, 2011, January 20th, 2012, February the 24th, 2012, March 20th, 2012, April the 17th, 2012, May 11th, 2012, and June 15th, 2012. The FDA has completed our evaluation of your firm's corrections and corrective actions and provide our responses below. Pre-market notification. On May 23, 2011, letter indicated that your organization has significantly changed or modified the graduated electronic decelerator devices since obtaining initial FDA clearance on December 5, 1994. We have reviewed your firm's responses to our letter and conclude that they are not adequate. Boom. In your responses dated July the 21st, 2011 and September the 14th, 2011, your firm requested enforcement discretion which would allow the continued use of the GED3 and the GED4A devices until a new 510K has cleared. We have reviewed your response dated July the 21st, 2011, and determined that your responses are not adequate. Your firm has not provided sufficient evidence to support the safety and effectiveness of these devices for treating aggressive behavior. Boom. Sufficient documentation to adequately characterize the output of the GED4 device and determine the documentation to adequately characterize the output of the GED4 device and determine stimulation received by a patient. And 3, any information regarding the physical and or psychological consequences of a student being placed in a pseudo-restraint via the holster. Based on the inadequacy of the documentation provided in your responses, we disagree that enforcement discretion should be applied in this circumstance. Your responses have indicated that 510K notice for the GED3A and GED4 devices and its accessories was being prepared. GMPs. We have reviewed all your responses that address the GMP observations noted in the May 23, 2011 letter. We acknowledge that your firm has hired as a third-party design, development, and manufacturing firm, and that they will be manufacturing these devices for your facility in the near future. We note that your responses have not yet addressed the following items. Your firm has not provided design validation procedures to demonstrate the device conforms to defined user needs or its intended use. Your firm has not provided evidence of how the final release specifications for the GED3 or the GED4 were determined, or how specifications relate to the final acceptance criteria for these devices. Your firm has not provided acceptance criteria for the GED devices in your DHR. Your firm has not provided a list of specific design input requirements in your design control program. You have provided a general listing of design input requirements, but do not list any specific design input requirements. Your firm has not provided a listing of all documentations that encompass its QMS, documentation regarding the review of the QMS for implementation and the document control, and documentation indicating that the uncontrolled, obsolete quality system documentations are no longer in use. Your firm has not provided a device master record. Please keep in mind that during a reinspection of your facility, we will need to verify that you are in compliance with all applicable regulations. Your response were reviewed by the FDA's Office of Surveillance and Biometrics. Upon review of the September 14, 2011 response, we acknowledge that your firm revised its MDR procedure to remove outdated references. However, your firm also removed information from its original procedure that should have remained in place. As such, the document now fails to meet the requirements of 21 CFR. The revised MDR procedure, titled Medical Device Reporting, does not meet the requirements of 21 CFR. The following issues were noted in the revised MDR procedure. REG001 does not describe an internal system that provides for a standard review process or procedure for determining when an event meets the criteria for reporting under this part. For example, there are no instructions for conducting a complete investigation each event evaluating the cause of the event. REG001 does not describe an internal process that provides for the timely transmission of complex medical device reports to FDA. For example, there are no instructions for how to obtain and complete the FDA Form 350A. The address identifying where the MDR report should be submitted is not included in the procedure. The address for the MDR submission is FDA CDRH Medical Device Reporting. In addition, Attachment 1, titled Medical Device Reporting Decision Tree, is not reliable as the print is very small. It's recommended that your firm revise Attachment 1 to make it readable for the user. Additionally, the adequacy of your response, dated November 15, 2011, cannot be determined at this time. The information provided in Attachment 14 indicated a spreadsheet with limited information for the complaints received. Your firm stated that it received a complaint referencing a second-degree burn for which first aid was applied. Your firm determined that the event was not reportable. Without additional information from clarifying what type of first aid was applied to the patient, it cannot be determined whether the application of first aid to the second-degree burn represents medical intervention necessary to preclude permanent impairment of a body function or permanent damage to a body structure, and therefore cannot at this time determine your assessment of reportability is correct. Boom! You lied! If your firm wishes to submit MDR requests via electronic submission, it can follow the directions stated under the following URL, which we don't really need. If your firm wishes to discuss MDR reportability criteria or to schedule further communication, it may contact the MDR policy branch. Blah, 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 blah. Please be advised that it is your firm's responsibility to assure compliance with the Federal Food, Drug, and Cosmetic Act in implementing regulations or other relevant legal authority. We request that you provide us with additional written response within the 30 business days from the date you receive this letter. Your firm's additional response should be sent to blah, 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 blah. Finally, you should know that this letter is not intended to be an all-inclusive list of the violations at your firm's facility. Oh! Do go on, FDA. Do go on. It is your firm's responsibility to ensure compliance with applicable laws and regulations administered by the FDA. The specific violations noted in this letter may be symptomatic of a serious problems in your firm's manufacturing and quality management systems. Your firm should investigate and determine the causes of the violations and take prompt actions to correct the violations and bring products into compliance. Boom. You shouldn't be using devices at all, but still. Boom. Let's do more digging into it, shall we? Oh, do go on, FDA. This tea is tasting exceptionally good this Thanksgiving morning. Oh, here's another warning letter. Right here. Same year. Oh, no, not same year. That's back in 2011. Oh, letter clarifying clearance of GED shock device and JRC non-compliance with regulations. Let's take a look-see. Oh, good lord, this goes back to 2000. Dr. Israel, we are enclosing a copy of the establishment inspection report for the inspection conducted at your premises from January the 31st to February 1st, 3rd, and 10th, 2000. This report provided to you for the information purposes. This new procedure is applicable to EIRs for inspectors completed after April the 1st, 1997. For those inspections completed prior to the above date, a copy of the EIR may still be made available through the Freedom of Information Act. The agency is working to make its regulatory process and activities more transparent to the regulated industry. Releasing the EIR to you is a part of this effort. The copy being provided to you comprises the narrative portion of the report. It reflects redactions made by the agency in accordance with the FOIA and 21 CFR Part 20. This, however, does not preclude you from any requesting, possibly obtaining information under the Freedom of Information Act. If you have any questions, please feel free to blah, 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 blah. Reasons for inspection. This inspection of the Judge Rotenberg Center in Canton, Massachusetts was conducted as a result of customer complaint number NEW 2042 Attachment 1. The complaint alleges that the graduated electronic decelerator GED4 are not reliable for use. It also alleges when the devices are reported as malfunctioning, they are not properly tested and not sent back to be used again. The inspection was conducted in accordance with the CP inspection of medical devices. History of business. The Judge Rotenberg Center, formerly known as the Behavioral Research Institute, is located in Canton, Massachusetts. The facility previously located in Providence, Rhode Island. The Judge Rotenberg Center continues to operate day and residential programming tracks for children and adults with behavioral problems, including conduct disorders, emotional problems, head injuries, autism, and developmental disabilities. There are 102 students enrolled in the program back then. Dr. Matthew Israel remains the president and the executive director of the firm. Thank God that's no longer a thing. If ever I believed someone belonged behind freaking bars, Matthew Israel is it. Summary of findings. On January the 31st, 2000, I visited the Judge Rotenberg Center located at blah, 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 Mass. Credentials were displayed and an FDA 482 notice of inspection was issued to Miss Anne Marie Izomani. Forgive me if I completely missaid that. Miss Izomani stated that she is the assistant director and the most responsible person of the firm at the time of my visit. It was explained that Dr. Matthew Israel, who's the president and director of the firm, was in a meeting and would not be available. Dr. Israel was not present throughout the inspection. Ms. Asimone introduced Mr. Robert Duquette, Assistant Director for Human Resources. Mr. Duquette was present for the entire inspection. Also present during the inspection were Mr. Jerry Kuchar, electronic consultant, Mr. Mike Corrigan, electronics consultant, and Mr. George J. Wallace, the firm's attorney. These three individuals provided the majority of the information contained in this report. The center uses devices that deliver electroshocks to patients as part of overall behavior modification program. It's fucking sick is what it is. Let's shock you. Bee sting my ass. I say we hook them up to the GED. Give the students the remote boxes. Then they can tell us about bee sting. There are currently 3 types of devices being utilized by the center on approximately 35 students. These devices are the GED1, GED3A, and the GED4. These units are manufactured at the center and are used exclusively by the center. The center currently has one approved 5010K for the GED1. It is explained that the GED3A is an enhancement of the GED1. There is currently 10 GED3A devices manufactured today. The GED3A is being used on 4 students because they're sick bastards. They're not hurting enough. Let's make another device that make it hurt more. Sick bastards. The GED4 is another device that was manufactured and first utilized in 1992. Dr. Von Hein is a clinical psychologist who supervises the overall program for students in his caseload. He belongs behind doors too, at the very least to have his license yanked. He stated that there are 6 students currently using the GED4 device. He believes that there were approximately 40 units manufactured to date. He explained that the differences between the GED and GED4 is that the GED4 output is 45 RMs. Because that's okay. We're going to shock you like 3 times at a higher rate than a police taser, which has been known to cause death, I might add. But it's okay. They're disabled. It's okay if we torture them. They're not human after all, right? The GLD output is 15 RMS. The GED4 utilizes 2 12V batteries. The GED4 is currently being used on 6 students. No specific submissions with respect to the GED3A or the GED4 have been made. It was explained that each patient is a ward of the court and it has a court-appointed guardian, a court-appointed monitor who is a psychologist, and a court-appointed neurologist and a court-appointed attorney. In other words, they don't get a choice. They have nowhere to run. They have no appeal. They have no one to go to. They just have to suffer. God. Both the court and the Massachusetts Department of Mental Retardation. Oh my God. Really? Even back then, folks, we were using terms like intellectual disability. You all freaking suck. Are aware of and have approved the treatment plans provided for each student. After discussions with the NEWDO compliant branch and CDRH, it was determined that the firm is exempt from 510K notices and the device is considered to be within the practice of medicine. Bull fucking shit it is. Bull fucking shit. It was not, you all just said in your other letter that we just read, not approved by anyone, not licensed by anyone. I call bullshit. I was instructed to close the inspection and not to issue an FDA 483. And I returned to the firm on February the 10th, 2000, Dr. Israel was present for the closeout via telephone, as well as George Wallace, the firm's attorney. Also present were Roger Duquette, Director of Human Resources, Anne-Marie Angelmon, Assistant Director, Jerry Kuchar, Consultant, and Glenda Cooks, Director of Residence and Student Services. I explained that I was determined that the firm was exempt under 80765. God, and I would not be issuing the FDA 483. However, deficiencies were discussed throughout the inspection. The firm asked if I would go over those deficiencies with them. I agreed to do so and relayed the following to them. Deficiencies found at the firm included lack of device history records, incomplete device master records, incomplete failure investigations, and the lack of calibration schedules for devices that are to be calibrated every 90 days. I thanked Dr. Israel and his employees for their time, and the inspection was closed. The firm promised to work on the deficiencies noted above, and yet never did. So, what are we learning this morning, boys and girls, other than, our federal government doesn't give a shit about you if you have a mental health issue or you have a neurological disability? We're throwaway people. I always knew that, but this case makes it more and more apparent to me every freaking morning. As if they think we're people at all. So, other than that blaringly obvious fact and having that constantly shoved in my face on a daily basis, we also have the fact that the JRC has not, to this day, not confirmed and got under the has not and continue to not meet any of the requirements in order to get their devices registered. They are using unregistered medical devices on kids. And then the DC Circuit Court tells them they have the right to do that, even though it is literally the FDA's freaking job to approve of medical devices to be used on patients. I really do hope that gets brought up during the appeal. Now, that's all I got for this morning, folks. I'm going to go ahead and close out. We don't get very many views on this channel, especially on this subject. The few that we do get do tend to get removed from time to time. So, folks, please don't forget to hit that like button. Hit subscribe. And, of course, don't forget to hit the comments. I do appreciate your time this morning. And as always, we here at Spilling Tea hope you have a good one. Bye-bye.